Welcome to the Nomination Support webinar for our inaugural Primary Health Excellence Awards. Thank you for joining us today. Before we get started, change this. I would like to begin by acknowledging the Aboriginal and Torres Strait Islander people as the traditional custodians of the lands in which we meet and work today. I'm on Wiradjuri land in Orange, New South Wales today, near the Gunnabulla. Beautiful cold orange. There are many Aboriginal languages across our region in the Western and Far West New South Wales, but also just across the whole of Australia, and it does really reflect that rich cultural diversity of First Nations people. I want to pay my respects to Elders past, present and future, and extend that recognition to all Aboriginal people watching this webinar. Okay, today we are going to look at the Primary Health Excellence Awards, what they are, what it's about, why nominate, the awards categories and how to nominate. You can ask questions via the chat at any time and we will address those at the end. So what are the awards about? These are the inaugural Western New South Wales Primary Health Network Excellence Awards, really highlighting primary health. We want to recognise and celebrate the great work happening across the primary healthcare in our region, looking at the impact of individuals, teams and organisations, whether that be in leadership, innovation, or simply just improving the care of our communities. Skip there. So what are the key dates? At the moment, nominations are open. They opened on the 11th of May. They will be open until the 22nd of June. So we're encouraging nominations across all primary healthcare in this time. There is an opportunity to nominate in all of the sectors and all of the categories, so please do that now. Then we'll move on to our judging process. So there'll be a short list and then a formal judging with health professionals and external people there. And then the finalists will be announced in October, which will then lead to the event on the 12th of November. It's going to be an evening dinner, providing just a moment to really come together and celebrate the excellence across our region. So we're excited to be all together for that. Maybe you're thinking, why nominate? Why should I nominate? Well, this is a great opportunity to recognise and celebrate excellence, to shine a light on individuals who are making a real difference in our community that just happens day to day and that doesn't get noticed. So we want to do that. We want to acknowledge the great success stories, the great work, the effort, the leadership, the impact that is happening across our region. So we want to just highlight that, strengthen connections with all of these amazing services and people and individuals and organisations. And now I'm going to hand over to Scott.
Thank you so much, Elodie. So I'm going to speak to the award categories. We have 6 award categories. So there'll definitely be a category for you to nominate yourself and give visibility to the successes that you're achieving. So our first award category is Aboriginal Health. It recognises impactful work which advances equity and self-determination, and it is for anyone who is undertaking effectual work in Aboriginal health in a primary care setting. Our second award category is General Practice. This recognises general practice staff who are excelling as leaders and enhancing patient outcomes, and it is for anyone who is working in a primary care setting. Our third award category is Innovation. So if you are showcasing pioneering evidence-based or digitally enabled approaches to care, then this award category is for you. It is for a professional or an organisation who is working in an innovative manner. Our Primary Care Organisation Award category highlights impacts achieved beyond a single service, which leverages collaboration and integration, or contributes to system improvement, and those programs or activities are sustainable and perhaps even scalable. So it is for organisations across the primary care sector that deliver or coordinate services beyond a single service. Our Emerging Leader Award is to recognise and celebrate strong leadership potential in early career professionals, and it is for any early career professional working in a primary care setting. That's an excellent award category to really encourage and recognise those young individuals who are making significant impacts and contributions already in their career. And our last award category is on the opposite end of the spectrum, and it is recognition of service. So it is acknowledging long-term contribution to primary care, and it is for individuals who have made an immeasurable impact to patients' outcomes across their career in primary health. Thanks very much, and I'm going to pass on to Meredith.
Thank you so much, Scott. So just to take everyone through the eligibility for the awards, they are open to individuals, teams and organisations, obviously depending on the category. And the work that's being nominated needs to have taken place within the 2025-2026 financial year. Nominees must be delivering primary health care services across Western and Far West New South Wales, or supporting directly those communities. Nominations are open broadly across all professions, and you can nominate yourself or someone else even across multiple categories if eligible. Just to keep in mind that nominations do need to be submitted by the closing date, so it is definitely worthwhile planning ahead and allowing time that you might need to gather the information required to complete the nomination form. So on to how to nominate. It's all done online through the Primary Health Excellence Awards website. The QR code is there, and we will also pop that in the post resources and possibly in the chat for you as well. You'll see, so that QR code will take you directly through to that page. From there, it's actually quite a simple process. You choose the most appropriate category, complete the nomination form and submit it online. Again, anyone can submit a nomination, so that could be a self-nomination, you could nominate a colleague, or you could even be from community and recognise what's happening in your community. The key with how to nominate is just to follow the prompts, keep your responses clear and focused, and submit everything through the website before the closing date. So just move on to the next slide. We're talking about making the process as easy as possible. It is really structured and consistent across all categories. So each award actually has 3 response sections, which have a maximum of 200 words, so you don't need to write long answers. The questions are designed to guide you, just simply describing what was done, the impact and how it was delivered. You will need to submit 1 image as part of your support to your application, and there is another optional section for any additional supporting evidence that you might like to submit. It could be anything such as testimonials, feedback, a case study evaluation, anything that you would like to put in, but again, that is optional. Once you submit your nomination, it is reviewed, shortlisted, and then the nominations will be assessed by an independent judging panel. They use a structured rubric, so everything is considered fair and consistent. So we just included this information to give a little bit of clarity in terms of what the judges are looking for. And a strong nomination is really going to tell a clear story. Whether you're nominating for an organisation or an individual, they should all have a clear example of impact, so clearly explain what was done, who benefited and what changed as a result. So again, specific achievements, simple and direct language, and focus on the outcomes and difference made. If you're from an organisation or nominating an organisation, judges look at how the work addresses these dimensions. So whether it's a community need, so if, for example, addressing a gap or improving access, how the work supports equity. So, priority on, for example, a rural or a priority population, demonstrating effectiveness. So again, improving access or reducing duplication, and sustainability, so that might be through integration, through partnerships or ongoing planning. For individuals, the focus is obviously on leadership, contribution, impact on patient care, effectiveness and quality. And just to reinforce, this isn't meant to be complex, keeping it straightforward, relevant and focused on impact. So when you're writing responses, it is useful to keep these in mind. So on to next steps. After the nominations close on the 22nd of June, they will go through a structured review process. There's initial check and review, and we will reach out to you if there's anything further needed, any further information required. The independent judging process will be throughout July and August, and it is designed to be fair and consistent. And then our finalists will be announced in October. This all leads to our exciting awards event, which is going to be on the 12th of November in Dubbo. So that is a quick overview of our awards and how to nominate. For support or questions after this webinar, please reach out to us at awards@wnswphn.org.au. We encourage you to sign up to our awards email list for updates and also access our support materials available on our website. I just wanted to say, look, thank you very much for attending today. Thank you for your time, and we look forward to engaging with you soon and helping, helping you with anything that you need for our nomination process. And we look forward to seeing you in November at our Primary Health Excellence Awards 2026. Thanks, everyone. Bye.